Alrighty. Hello. Welcome. We're here. We made it. This is our Heart Healthy Nutrition class here on the first Wednesday of the month. My name is Melissa. I'm HealthWare's registered dietitian and personal trainer. I'm so glad you're here, whether you're watching live here right now on Facebook, or if you're watching the recorded version later on Facebook or on YouTube. Welcome. If you're here watching live or in a recorded version, please let me know if you have any questions, any comments about what we're talking about today. Would love to see if you're here. Let me know. Feel free to ask any questions, type them in during class, and I'll do my best to answer any of those. I'm gonna scoot my camera just a tiny bit closer. Ooh, a little squeaky. Alrighty, there we go. So, today we are talking about triglycerides. What are they, why they matter to your health, and what you can do starting now to improve your triglyceride levels. So, what are triglycerides? We're going to start with that. If you've ever had an annual blood test from your doctor, or if you've been to the HealthWare office for a wellness screening, then you've probably heard of triglycerides. You've probably had them tested. Triglycerides are a type of fat in our blood. They come from foods that we eat. That's the typical source of that. In fact, most of the fats we eat, like butter, margarine, and oil, are in triglyceride form. In addition, excess calories, alcohol, and sugar that we consume are turned into triglycerides and are stored in fat cells throughout the body. When your body needs energy, it releases the triglycerides and VLDL cholesterol, which is also called very low density lipoproteins or bad cholesterol, which carries the triglycerides into your tissues. Having a high level of triglycerides in your blood is associated with increased risk of heart disease, and that is why it's important for us to discuss this topic. Whew, I thought I was going to sneeze. Okay, we're okay. So, triglycerides versus cholesterol. We're going to sort of discuss the two. Before we get too far into triglycerides, let's touch quickly on the difference between triglycerides and cholesterol. Typically, they're both tested at the same time. When you get your cholesterol tested, your triglycerides are tested as well. They're both a fasting lab that you get drawn. So typically done at the same time. They're part of the lipid panel. So triglycerides and cholesterol are both fatty substances known as lipids. So that's why it's called a lipid panel when you get those drawn in your blood. But triglycerides are fats, cholesterol is not. Cholesterol is a waxy, odorless substance made by the liver that is an essential part of our cell walls and the nerves in our bodies. Cholesterol also plays an important role in our body functions, such as digestion and hormone production. Cholesterol comes from animal foods that we eat, but also our bodies do produce cholesterol, which is why we don't need to consume it. Our bodies do that for us. So that's a bit of the difference between cholesterol. So triglyceride levels are usually measured whenever you have a blood test, like I already said, which is called a lipid profile. That's one of the tests that we do at the HealthWare office. We do it from a little finger poke. Usually when you go get labs drawn for your primary care or wherever, usually you get it drawn from your arm. We do it finger poke at the HealthWare office. I recommend that all adults have a lipid profile checked every year. Sometimes more frequently if you have numbers that need to be lowered or improved more frequently. So at least once a year is what I recommend for adults. The lipid profile shows you your triglyceride level, your total cholesterol level, HDL cholesterol, which is the good cholesterol, high density lipoprotein is what HDL stands for, and also the LDL cholesterol, which is the bad cholesterol, or low density lipoprotein is LDL. The amount of triglycerides in the bloodstream rises and falls throughout the day. After you eat, the levels are typically high. Therefore, testing triglycerides is usually done fasting. That's what tells us the best information. When you haven't had anything to eat or drink for 12 hours, then we know what your baseline triglyceride levels are. If we test you right after you eat, they're going to be higher. So triglycerides are measured in milligrams per deciliter, which is not super important to any of us, right? We just know the number, but that is the measurement, the units, milligrams per deciliter. And the guidelines for triglyceride levels are, and I'm gonna show you, I'm gonna hold it up for you. Here we go. Hopefully you can see that. All right, I gotta be able to see my notes. So these are the guidelines for triglyceride levels. You can see the different categories. We have normal, borderline high, high, and very high. There's 4 different categories. Normal would be less than 150. Borderline high is 150 to 199. High is 200 to 499. And very high is 500 and above. Levels that are, I'll put this back, levels that are above 150, so borderline high and above 150 is where you may be putting yourself more at risk for heart disease. It's in the general population that we see at Health Aware that I've seen very high triglyceride levels above 500 is not super common, but definitely in that borderline high category. If you saw, remember you saw 150 to 199, that is definitely a common realm to be in. But we want them to be below 150, ideally under 100. So what causes high triglycerides? There are many, many factors that affect our triglyceride levels. So I have a nice list of a few. But yes, there are many, many reasons. Regularly eating more calories than you burn off, so excess calories, especially if you eat a lot of sugar. Being overweight or obese, lack of physical exercise, cigarette smoking, excessive alcohol use, certain medications, some genetic disorders, thyroid diseases, poorly controlled type 2 diabetes, and liver or kidney diseases. All of those things can have an impact on our triglyceride levels. So how can your triglyceride levels be lowered? That's why you're all here watching today, probably. You want to know how we can improve that. So first, your doctor needs to check for certain factors that may be affecting your triglyceride levels, such as medications, thyroid function issues, poorly controlled diabetes, and liver and kidney disease. Any of those factors can cause triglyceride levels to be higher than normal, and those aren't necessarily just lifestyle changes that can affect those. Those are more of the medical issues that need to be managed, first of all. The quickest and easiest fix for high triglycerides is medication. Of course, typically statins, but thankfully, there's an alternative to medication, which I know is what most people are interested in. I don't think maybe once. I've had one patient, I think, in the last 5 years or 4 years, that has come into the healthcare office and said, I just want to take a medication to fix my triglyceride and my cholesterol levels. Pretty much everybody else, except that one patient, has wanted to not take medications. So, lifestyle changes is what we're focusing on today, not the medications. There are several lifestyle changes that can help lower triglycerides. We're going to talk about 6 different ones today. That's why I have my show and tell here. So the first one, my highly sophisticated PowerPoint sort of replacement. First one is controlling your weight. If you're overweight or obese, just plain old weight loss actually can significantly improve your triglyceride levels, among many other health benefits. Weight management, losing weight, is so beneficial for a number of health factors. So many things can be improved with weight loss. So for triglycerides, losing even just 5 to 10% of your total weight can have quite a significant impact on your triglyceride levels. If you don't know how much weight you need to lose or should want to lose, or if you need help getting started, I am happy to make an appointment with you at the Health War office to test your weight and your body composition and to come up with a plan for you. Weight loss is something that I do a lot of work with, something I like helping people with. So make an appointment with me. I will help you with weight management. For a little bit of perspective, that 5 to 10% of weight loss, and actually some health things can be improved with just 3 to 5% of weight loss. So 5%, let's say you weigh 200 pounds, 5% of that would be 10 pounds. I'm making sure I'm doing that math right in my mind. Yes, 10 pounds. 10 pounds is 5%, and that can actually make a big difference in triglycerides, among other things, even cholesterol. Okay? The second point that we're talking about today is regular physical activity. I talk about this a lot because I'm very passionate about exercise, physical activity, something that I enjoy doing and I like to encourage in others. But physical exercise, physical activity regularly is something that can help triglycerides. The current exercise guidelines for general health, not necessarily weight loss, just general health, is 150 to 300 minutes per week of moderate intensity cardio exercise. So moderate intensity is when your heart rate is elevated, your breathing rate is elevated. You could still talk to someone if you needed to, but you couldn't sing them a song. So that's the cardio part. Additionally, 2 to 3 days per week of strength training exercises for all the major muscle groups. And there's no real time limit on that one, but you do want to be working at an intensity level that challenges your muscles, making sure you're getting the arms, all parts of the arms, the core, as well as all parts of the legs. Almost no one meets these physical activity guidelines that I see at the Health Aware office, or just truly in most of life. Almost no one meets these physical activity guidelines. So it's no wonder that our country has such a terrible time with high triglycerides, weight, and all the things associated with being overweight. Yeah, exercise is very important. So working your way up, if you're not used to exercising, working your way up slowly, aiming for 30 to 60 minutes on 5 days a week. That'll get you your 150 minutes to 300 minutes. So 5 days a week, 30 to 60 minutes of that cardio. I teach here on Facebook a strength training class once a week. That would count as one of your strength training sessions, those 2 to 3 that you're supposed to get in the week. So would love to have you join me, get you on your way to your physical exercise guidelines. All right, number 3. This one is reasonably self-explanatory. No smoking. All right, smoking is not good. It affects so many aspects of our health, from triglycerides to heart disease, cancer, so many things. Smoking is not good for our health. If you struggle with smoking, whether it's cigarettes, cigars, vaping, please look into quitting. Let us know if you need assistance with that. We don't have a specific smoking cessation program right now, but we can do some wellness coaching with you to at least help you work through that if possible. But quitting is the recommendation. And I know it's easier to say that than do it, but there are so many health benefits that can come from quitting smoking. All right, off of my smoking soapbox. Now to point number 4, consuming healthy fats instead of saturated fats. We've discussed this topic before in this class about the different types of fats, saturated fats. It's a big topic in heart health. So it's always worth mentioning though, because it comes up a lot. Healthy fats versus the unhealthy fats. It's very important to understand that. So saturated fats have a negative impact on our triglyceride levels, meaning they are bad for our triglyceride levels. Among other things, saturated fats aren't good for the triglyceride levels, but it's recommended to switch out saturated fats, remove those for some of the healthier fats. Saturated fats are found in animal-based foods, such as meat, poultry, especially the skin of poultry, dairy if it's has fat in it, not the non-fat or skim type of dairy, other dairy, cheese, eggs, the yolk is where the saturated fat is, butter, cream, any of that stuff, and also coconut oil and palm oil. Those are the plant-based sources that are primarily saturated fat, coconut oil and palm oil. I know that coconut oil has been very popular in recent years, though losing a little bit of its hype, I think, recently. But coconut oil is a plant oil, but it does contain mostly saturated fat. I want to say it's 92 to 94 something percent of the fat content is saturated fat. 1 tablespoon gets you to the maximum amount that you should be eating in a day of saturated fat. Palm oil is not something that we typically have in our cupboards. You don't usually go buy palm oil, but it is an ingredient in a lot of packaged foods. So crackers, chips, cookies, as well as peanut butter, those kind of nut butters, they actually will have palm oil added to them because it helps them, become more creamy. You don't have to stir the ones that have palm oil in them usually. So check out your packages of food at home. See if any of your products actually contain palm oil. Read those ingredients. Palm oil is a source of saturated fat. So the healthy fats, instead of those saturated fats, we want to choose healthy fats. So the healthy fats are ones that are found in plant-based sources. That would be from avocados, nuts, seeds, extra virgin olive oil, that's the healthy oil for us, and omega-3 fatty acids, those are healthy fats. Those can help, specifically, those can help reduce triglycerides. Omega-3 fatty acids can be found in fatty fish. If you eat fish, so salmon and tuna, sardines, or the plant-based sources would be walnuts, ground flaxseed, or chia seeds. You can also take supplements of omega-3 fatty acids, but always best to get things from the food sources if you can. Alrighty, number 5, moving on, limiting your intake of alcohol. It's been interesting. During COVID, I've had actually a lot more patients talking to me about increased alcohol intake. It's been a rather popular theme in the last few months since COVID started, but recently the patients I've been seeing in the last few months, alcohol has been very popular. So limiting intake of alcohol, in some people this actually can be more impactful. Alcohol can significantly affect triglycerides for some people. It's hard to know just off the top of your head if you're one of those people. So it would take testing and then removing alcohol and then retesting to see if that is a factor for you. But for some people, it can be a big factor. So it's important to note that. Drinking in moderation is defined by the CDC as up to 1 drink per day for women and up to 2 drinks per day for men. If you drink more than that, reducing your intake of alcohol could be very beneficial. If your triglycerides are high, I recommend removing alcohol completely. And just to clarify, one drink is the equivalent of, I think it's 1 or 1.5 ounces of hard liquor, 5 ounces of wine, or 12 ounces of beer. And Molly said something. She said, I stopped drinking altogether so that I can see how my body will heal. Yes, exactly. Alcohol is a very popular thing in society, of course. I myself do not drink alcohol. Never actually tasted it before in my life. I choose not to drink alcohol because I know of the health benefits associated with it, but I understand that society, alcohol is a very popular thing. It's a social thing to do. People enjoy drinking alcohol, and that's fine, but when we look at it as it relates to health, limiting alcohol intake is the recommendation. There are some health benefits that may be associated with red wine, but I always tell people, if you're drinking because you are with the intention of having health benefits, you would be better served to just not drink any alcohol whatsoever. If you're drinking red wine because of the health benefits, it's probably more so because you enjoy it. So I would choose to not drink if you want the most health benefits, okay? Yeah. All right. Then the final point, number 6. I will remove my little paper clips. There we go. Limiting intake of sugar and refined grains. This is what I talk about probably the most when I see patients at the HealthAware office trying to reduce reduce triglycerides, okay? This is the factor that most people find the most complicated, the most difficult. Nutrition is hard. I understand that completely, but it is important to understand this point because it really can make a big difference in your triglyceride levels. Sugar, more specifically added sugar and refined grains, are also referred to as simple carbohydrates. We're not necessarily talking about fruit as much, though fruit may have an impact on triglyceride levels. And I'll go through many of the examples here in a moment, but added sugar is more specifically what we're talking about. Simple carbohydrates, so the added sugars and those refined grains. Simple carbohydrates are digested quickly, and they can send immediate bursts of glucose or sugar or energy into the bloodstream. That's why you may feel a sudden rush of energy when you eat a dessert or something else sweet, and then shortly followed by a crash of fatigue when that sudden burst of energy is depleted. So our blood sugars go way up when we have those simple carbohydrates, and then they go way back down. They're digested quickly, and that's what happens. Let's talk more specifically about that sugar, like I said. So all sugar, even natural sugar, when eaten in excess, can affect triglycerides. I'll say it again. All sugar, even natural sugar, in excess can affect triglyceride levels. So we're talking about white sugar, brown sugar, maple syrup, honey, agave, soda, the regular soda, energy drinks, blended coffee drinks, candy, chocolates, pastries, cakes, cookies, pies, all other desserts, even actually fruit juice, which is surprising for most people. All of those things are within this sugar umbrella. With packaged foods, take time to read the ingredient list to make sure there aren't any hidden sugars with fancy names like sucrose, glucose, fructose, corn syrup, maltose, or high fructose corn syrup. Those are all names for sugar, okay? Very important to read the nutrition labels on our foods, the ingredients labels. The American Heart Association recommends consuming no more than 6 to 9 teaspoons of added sugar per day. 6 is for women, 9 is for men. So that's 24 grams of added sugar for women, less than that. or 36 grams of added sugar for men. Less than that a day. Closer to 0 is better. And again, this is added sugar, not like an apple or a banana. Added sugar would be maple syrup, sugar, like white sugar, brown sugar, honey. Those would be added sugars, okay? The sugar is found naturally in fruit and dairy, which is lactose. There will be natural sugar in both of those food categories, fruits and dairy. Those are not classified as added sugar. So if you look at a container of milk or plain Greek yogurt, for example, in the dairy category, you'll see that it does actually contain sugar. But that is natural sugar. As long as it's plain, not a flavored thing, but plain dairy, yogurt plain, or milk. Lactose is in those foods. That is natural sugar, and that is not what we're talking about. And Billy said, oh yes, Billy, I will definitely email this to you when we're all done. So, added sugars is really the focus. The sweeteners put into flavored yogurt, those would be added sugars. So, essentially, everything sweet other than whole fruit and plain dairy are added sugars. That may be an overgeneralization, but it kind of works. If that helps you remember, yes, pretty much everything else. So if you want to choose something sweet or want to eat something sweet, then whole fruit would be your best choice. Let's talk now about the refined grains. We're still in this category of sugars and refined grains. So refined grains are the ones that have been processed with much of the nutrients and fiber removed. They will actually add the nutrients back in. When they strip all the nutrients away, they then add in some other nutrients. So foods that are part of this category of refined grains are any items that are made with bleached, enriched, or refined flour, which is commonly called white flour. And it has very low fiber content. So pastas, crackers, breads, cereals, all of those things can be refined grains within that category. If they are made, if any of those foods are made with whole wheat or whole grain something, that is not a refined grain. Those whole wheat, whole grain foods are in the complex carbohydrate group, and those don't have as big of an impact on our triglycerides. Those are good for us. White rice is also considered part of the refined grain group, unfortunately. Brown rice is not, or wild rice, those are not. Not all grains and starches are bad. Like I said, instead of the refined grain foods, you want to choose those that are made with the whole grains, and they have whole grains or whole wheat as their first ingredient in the ingredient list. Or perhaps even as their only ingredient, like oats, brown rice, barley, quinoa. Those would be one ingredient foods, and those are whole grain foods. There are tons of options these days for whole grain, breads, crackers, pastas, cereals, lots and lots of options. So for example, Triscuits, they are made with whole wheat. I think they only have 3 ingredients: whole wheat, canola oil, and salt, I think. So that would be considered a whole grain food. Yes. So in conclusion, we've talked about a lot today in class. So in conclusion, triglycerides are an important part of heart health. They're important to know about and to understand, and they can be managed with lifestyle changes rather than just medication. Not for everybody. Sometimes there are certain cases where you do need to take a medication, but it is possible to manage them for most people with lifestyle changes. If you don't know what your triglyceride level is, or if you want help improving that number, I am more than happy to help. Andrea and myself at the HealthWare office. We are happy to help you with that. Call us at the HealthWare office or send me an email and we can set up an appointment. get your triglyceride levels figured out, and help you set up a plan to help improve those and your overall health. Thank you so much for watching this morning. It's been great having a few people here with me live. I'm glad that you've been enjoying these online classes. We have a bit of a bigger reach online than just in person because these are saved and you can watch them at any time. So let me know if you have any questions. Billy, I will email you the handout. Until next time, everyone, happy Wednesday. I'll see you next week. Bye.